Health. We have a wonderful program for you today. We have an outstanding guest. Dr. Pamela Smith joins us. Dr. Smith has a near encyclopedic mind with a depth of knowledge that we can all learn and benefit from. We want to talk about her book, What You Must Know About Vitamins, Minerals, Herbs, and More. Do you know what B3 is? B6? B12? Do you know what they are? If you don't know, you should know, and this book will help you learn these concepts, because these are the things that will keep you healthy and well into your senior years. Stay tuned for our show today when Dr. Smith joins us, but first let's go to our news. Let's see what's happening in the health world. High levels of stress while at work may increase the risk of diabetes. Researchers from the German Center for Diabetes Research followed more than 5,300 healthy workers, ages 29 to 66 years of age, for an average of 13 years. They found the workers with high levels of mental stress, along with little ability to change that stress, were about 45% higher risk of developing diabetes by the end of the study. The study was published in Psychosomatic Medicine. Related research from Copenhagen University finds continuous workplace stress is the #1 cause of prolonged absence from work due to illness. The study found stress has its greatest effect on those whose work requires high levels of knowledge, social competence, and creativity. Folks, in today's world, our work and personal identity has become increasingly intertwined. And since our work plays such a major role in defining us, failures at work may become a life and death level stressful event that plays out day after day. And as our first study found, if we can't do anything about our work stress, we will pay a high price in the form of declining health as we age. Epidemiologists have known for some time those who work under prolonged stress have higher rates of anxiety, insomnia, chronic pain, and infectious disease, along with potentially life-threatening cardiovascular disease. But this is the first study to find work stress can lead to diabetes as well. Now keep in mind, diabetes is a major risk factor for cardiovascular disease, increasing that disease's risk by up to 400%. Now it's entirely appropriate to discuss measures to help control our stress. Regular exercise, eating a healthy diet, taking the right dietary supplements, along with having a supportive life partner and family, well, these are the remedies we expect to hear of from health experts. What the secular world always seems to miss is the vital importance of keeping our faith strong, knowing we cannot control all things and that we are not alone in this stressful modern world. He is with us always, and that thought alone does more for relentless stress than any other thing. From the first study of its kind, researchers find our intestinal flora may vary greatly from day to day. Researchers from the Massachusetts Institute of Technology followed 2 volunteers for over 1 year. They conducted extensive daily tests on the subject's intestinal bacteria, even if they traveled to a foreign land or became sick with food poisoning. They found overall the intestinal bacteria's numbers and types were relatively constant. However, on any given day, the amount of one species of bacteria could change many-fold due to factors such as diet, stress, travel, or infections. They found that study subjects over the course of the year-long study could harbor up to 1,000 different species of bacteria, but on any given day, only 100 to 200 different species were present. They also found that diet was the most important factor in determining intestinal flora content and quality. The study was published in Genome Biology. Related research from the British Medical Journal finds eating just 5 servings of fruits and vegetables a day is enough to reduce the risk of disease and early death. The study reviewed 16 previous studies involving almost 1 million subjects. And from University College London, researchers found if dietary nutrient intake declines with age, it accelerates a cellular process that inhibits immunity, causing increased susceptibility to life-threatening infections and cancer. You know, folks, so many of our modern scientific studies set out to find a new drug or a new use for an old drug. But oftentimes, the researchers find that our daily health routines, the foods we eat, the dietary supplements we take, well, they're the most effective measures in preventing disease, and in many cases, treating disease. Our above studies are an example of this concept. Our intestinal flora is diverse, and it changes from day to day depending on stress, illness, and even travel to foreign lands. But it is our diet that has the most profound effect on our intestinal flora. And from the British Medical Journal, eating just 5 servings of fruits and vegetables a day is enough to prevent serious disease. Now, no drug will ever replace fruits and vegetables. And finally, from University College London, we find a decline in nutrient intake with age greatly accelerates the decline in immune function associated with age. These researchers were looking for a drug that could help to achieve preserved immune function, but what they found was diet and dietary supplements work best. Well, today we have a very special guest. Dr. Pamela Smith joins us. Dr. Smith has written a wonderful book that should be in every one of our viewers' libraries. What you must know about vitamins, minerals, herbs, and more. If you'd like to help assure good health for years to come, today's program's for you. Come along, join us. We'll have fun.
May Savings Time is here again with our annual Cancer-Free celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online or call 888-442-1828 and place your order today. Ask about the auto ship program for additional savings.
I'm Cindy Becker, and this is Your Health at a Glance. Did you know the typical baby born in America today has over 200 foreign chemicals in their bloodstream? The world is a polluted place, but just how polluted may come as a surprise. Health experts report that pollution plays a major role in the development of ADHD, obesity, cardiovascular disease, Parkinson's disease, ALS, and a wide variety of cancers, including prostate and breast cancer. There are safe and simple steps you can take to lower your exposure to chemicals. Eat an organic, pesticide-free diet whenever possible. Be careful with the home use of chemicals. Don't consume fish that may be contaminated with mercury. Have your water supply tested for purity and add houseplants to lower indoor pollution levels. By taking a few basic steps, we can protect ourselves from disease-causing pollution. For Your Health at a Glance, I'm Cindy Becker.
Every day, about 200 million Americans do not get enough of a key essential mineral.
That mineral is magnesium. The typical American diet does not supply enough.
And magnesium is so important. It protects bones and helps more than 300 different enzymes in the human body perform efficiently.
That's why BioInnovations offers chelated magnesium capsules for oral use and topical magnesium gel to be applied to the skin. That's 2 forms of magnesium to meet your daily needs.
Scientific evidence points to chelation as the best method of vitamin and mineral formulation.
So call 888-442-1828 or go online at bioinnovations.net to place your order. Ask about the auto ship program for additional savings.
Because chances are you are one of the 200 million Americans who need more magnesium every day.
Welcome back, everyone. It is such a blessing to be with you today. Well, as promised, Dr. Pamela Smith is back with us today to discuss her book, What You Must Know About Vitamins, Minerals, Herbs, and More. Dr. Smith is the co-director of the Master's Program in Medical Sciences with a concentration in metabolic and nutritional medicine at the Morsani College of Medicine, University of South Florida. And today, she's going to teach us about the nutrients we need for a very healthy life. Welcome, Dr. Smith. Thank you for coming back to Texas.
Oh, thank you for inviting me.
I'm so glad you came back because we just can't learn enough about the nutrients that we need to stay healthy.
Thank you, Dr. Smith, and I want to compliment you on a wonderful book. You went above and beyond on this one.
Thank you.
You did a really good job. Let's start with the basics here. You know, I think most Americans feel that if they eat a healthy diet, they're fine. And we want you to eat a healthy diet. But let's talk about what Americans eat. Can we really get by on just assuming that our foods have all the nutrition we need?
We don't, because when we fertilize, we put nitrogen and phosphorus back into the ground, but we don't replenish the very important minerals that our brain needs. We need for vision, we need to maintain bone structure. They're not replenished. And how you get nutrients from food is the ground that they're grown in. So it's very important that we look at a lot of different things, from how we eat. In fact, honestly, it's amazing. 25% of Americans, the only vegetable they eat in a week is a French fry.
Wow.
That's the only vegetable.
And it's fried in who knows what.
And so, could we eat better? Of course. Does anybody eat perfect? No. And you'll enjoy this story. One of my patients, husband and wife team, I see them together, and one of them had a little bit of a hard time losing weight. The other one didn't. And so I said, well, you know, nobody eats perfect. Just get back on the wagon.
Right.
No one is a nun or a monk.
Right.
You know what they said?
What?
The wife said, you don't know, do you? And I said, what? She goes, I used to be a nun, and he used to be a monk. But the point being, nobody eats perfect. When you fall off the wagon, just get back on and start every day as a new day.
You know, doctor, so many of our fellow physicians tell their patients when asked about vitamins and dietary supplements, you don't need any of that, it's unproven, just eat healthy. And they leave it at that. The whole nutrition science is summarized in eat healthy.
Well, what does that really mean?
Yeah.
I mean, eating healthy for most men would be 6 small meals a day. For most women, 5 small meals a day. So not the bigger portions, but the smaller. It's important to have good carbohydrates. Sometimes people think that fruits and vegetables are not carbs, but most fruits and vegetables are at least part carb, if not all. So when we talk about broccoli and asparagus and green beans, those are carbs.
Right.
They're just better carbs.
Better carbs. Great
to have protein. We need some really good protein, which can be from meat, or it can be from nuts, or cottage cheese. There's a lot of good sources of good protein. And then, of course, good fat. I love avocados. Avocados are like food of a god. It is a fabulous source of good fat, omega-3 fatty acids.
This sounds like the Mediterranean diet. Do you believe in the Mediterranean
I
diet?
do.
Yeah.
The Mediterranean diet is very anti-inflammatory. So it decreases inflammation in the body. And they actually did a study showing that it only takes one meal that's good or one meal that's bad that changes inflammation after just one meal.
Wow. Wow. So the notion of gathering the family for the sit-down meal where we prepare some foods, that one meal a day can really make it for you.
It can in many ways, including really just being together with the family, because good relationships are so important for your health. Last night I dined out here in Dallas with one of my friends who happens to be a chiropractor. And we went to a Mediterranean restaurant at my request. And we had fabulous food. We had a great Greek salad. We had a little bit of doma, which is rolled grape leaves. And then we had some lamb meatballs. Lamb is really interesting food.
It is.
Because it's very high in omega-3 fatty acids. You don't have to worry about mercury, and it's the highest known food in carnitine, which is a really good nutrient for fueling source.
And how do you feel today?
I feel fabulous.
The brain is alive and ready to go?
My brain's alive. I didn't feel overstuffed. My brain was sharp when I left. I slept really well and very invigorated this morning after I ate a good breakfast.
Yes. See, that's the thing that we often gloss over. The effect of a healthy diet is virtually immediate.
It
helps
is.
us right away. Just tremendous. Okay, since our soils are depleted and we're not putting back the minerals we need and we eat on the run, yeah, I mean, I live in the world too. Sometimes we have to eat some fast food here or there. How can we compensate for this fast pace? Can we take some vitamins? Does it really make a difference? Let's talk about how we can supplement.
Well, in supplementing, we have to look at really what your lifestyle is. So let's say that you are a vigorous exerciser, you marathon or you pump iron 7 days a week. That would be aggressive exercise.
Yes.
When you exercise to that extent, you deplete your body of extra nutrients. So people that are really big exercisers would benefit from coenzyme Q10, carnitine, D-ribose, alpha-lipoic acid, just because they exercise. Also, at about the age of 50, your body starts making less nutrients, commonly the ones I just mentioned, and so starting at 50, we need extra nutrients as well. And then, of course, if you're stressed. When you're stressed, the body chews up a lot of nutrients, and the same thing happens if you eat a lot of sugar. Sugar strips the body of a lot of different minerals. So it's easy to become deplete, but the good news is we can eat our way into it and we can supplement it.
Well, Dr. Smith, I know that we have always been advocates of a low sugar or no sugar diet, but there are so many foods with hidden sugars. Can you address how, I mean, we're going to be exposed to a little bit of sugar. I don't know how we can avoid it.
We
Completely.
absolutely are exposed to a little bit of sugar. In fact, it's important if you have salad dressing that you look at a healthier salad dressing like vinegar and oil. Ketchup is fine if that's the only sugar you have in a day, because everybody gets a little bit of sugar, but ketchup has a little more sugar in it than other things do. So it depends on where you get your sugar. Alcohol is a sugar. That doesn't mean don't drink. What it means is moderation is the key to health. And you wouldn't want to eat a lot of bread, drink a glass of wine, and have dessert all at the same time.
And have a 48-ounce mega gulp soda at your break at work.
Exactly.
Well, it's cumulative.
It is
and
cumulative.
that's the point, is that, you know, these hidden sugars, okay, if it's just in one thing, but the way they add up, and then so people think, I don't eat sugar. I hear that all the time. I eat no sugar. Then you start looking at your labels and you think, well, they just fooled me. I didn't realize. So it really does pay to look at our labels, doesn't it?
It does pay. And I happen to like things like ketchup. So do I eat ketchup? I do. But if I put it with my potatoes, then I basically try not to eat anything else sweet that day.
Yeah, right. You know, I think one of the things we could do to help us is to prepare more of our own foods. Now, when Cindy and I go to the grocery store, the attendant always says something like, "Are you having a dinner party?" They're not used to seeing people buy so many groceries. And I simply say, well, we hardly ever eat out. We prepare all of our own food.
When you prepare your own food, you know what you get.
Yeah.
When I go to a restaurant, honestly, I don't look at the menu. I basically tell them what
them what
I
you
would
want.
like to dine
See,
upon.
that's smart.
Because I'm paying the bill.
Right.
And so I try and make a little healthier choice. I don't have them put gravy on anything because commonly it has a lot of sugar added. So I have my food grilled. I have a nice salad and then maybe some asparagus or green beans.
So reading through your book and reading other scientific writings, it's become evident that even though we try hard to eat healthy, and even though we may make the majority of our foods organic, we can still fall short on our nutrition. Is this what the science is saying?
This is what the science is saying.
Okay.
And of course, we can measure 35 vitamins in your body. If you see a metabolic anti-aging specialist, we can have this done. But you can also use general guidelines. How much you exercise, what medicines you take. For each medicine that you or your loved one might be on, it causes a nutritional depletion. So we can go and augment too without always measuring.
Folks, let's go to a break now, but when we return, let's talk about what Dr. Pamela Smith's new book will help you with. Vitamins, minerals, herbs, and more. What will you learn from this book, and how can you apply it to improving your diet and your health? We'll be right back.
May Savings Time is here again with our annual Cancer-Free Celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online or call 888-442-1828 and place your order today. Ask about the auto ship program for additional savings. I'm Cindy Becker for Your Health at a Glance. We all have said, I need to get some exercise, but how many of us put on our walking shoes and go? Learning a little more about the health benefits of exercise may help you get motivated to lace up those walking shoes. Exercise helps to control our appetite and weight. It maintains strong muscles. It promotes the release of endorphins that counter depression while helping us feel good about our lives. Exercise helps to lower blood glucose, promotes a strong circulatory system, and controls cholesterol. Exercise even helps us get a good night's sleep. Recent research finds dog owners who regularly walk their pet are 34% more likely to achieve fitness goals. You can get all of these health benefits by walking 30 minutes 4 times a week, just 30 minutes a day. Start today, and you'll start to get all those benefits. For Your Health at a Glance, I'm Cindy Becker.
Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with gastro defense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford. Order online at bionovations.net or call 888-442-1828 and ask about the auto ship program for additional savings.
Welcome back, everyone. We're having a great discussion with Dr. Pamela Smith about her book, What You Must Know About Vitamins, Minerals, Herbs, and More. This is quite a book, everyone. This is a great guide. Anything you want to know about the nutritional aspect of how to take the vitamins, different nutrients and what they do to us, how they work in our body, it's all in here. Yeah. Fantastic guide. This needs to be on your library. Well, to help you get this today, I have a great special with Noni. You love your specials with Noni, so I'm doing this one for you again. With your organic Noni, regular Noni, or Noni concentrate, that's a case of whichever one you want, you're going to get a copy of the book free. That's today only, so don't miss out on that one. Dr. Smith, as I was looking through the book and I was reading about how to supplement, something came to mind, and Richard alluded to that earlier in the show, and that was, do I really need to take supplements if I have a healthy diet? One of my employees is very blessed to be pregnant with her 3rd child. We're also excited that we're going to have a bio baby boy. Since I have no grandchildren,
yes,
she's putting up with me. At any rate, we're excited about this. So she just went to her last visit, and she asked the doctor about taking omega-3s because she has heard from Dr. Becker over and again the importance of the omega-3s on the development of her unborn child. And the doctor said, you don't need to do that. Yeah. You eat plenty fine.
Well, the studies actually show that if a pregnant woman takes omega-3 fatty acids, her child tends to have a higher IQ and less ADD, less dyslexia. So now a lot of the prescription vitamins that we give pregnant women do contain omega-3 fatty acids.
What can we do to spread the message out there to all of the mothers out there to don't listen when your doctor says you don't need to supplement? Ask for supplementation.
Well, a lot of times physicians are not trained in vitamins and nutrients and really how the body works. They learn their first year in med school a little bit of biochemistry, but then they never later to apply it to the patient. The good news is we can measure all of this now. We know what the patient literally needs, and we also know that to maintain vision, memory, and mobility, that we have to be nutritionally sound.
You know, I want to hit this a little more, this notion that nutritional measures are not well researched. The other day I searched the PubMed, National Institutes of Health, Lipitor, just Lipitor, you know, the cholesterol drug. Let's see, it was some 6,200 articles popped up. Then I went to curcumin, 7,000 articles, more than Lipitor. What do you think of that?
In fact, since 1998, there's been more studies in conservative medical journals about nutrients than medications.
Yeah. There's so much information now, and as you read that, you are absolutely convinced, folks. I am. We bring you the science every day on this program. You need to take a multiple vitamin. Now, give us an idea. I want to start a good multiple. What do I look for? What are the basics?
Well, you want to make sure that the multivitamin contains minerals, because you need minerals for vision. It's very important to have things like selenium and vitamin A and its derivatives for vision. You definitely have to have many minerals to maintain bone structure so you don't have osteoporosis or osteopenia, which is mild bone loss. So it's not just calcium. You need magnesium and boron, selenium, manganese for bone. And then, of course, your brain needs a lot of different nutrients at the right amount to help maintain memory.
That sounds like it's hard to get in one little pill.
It is.
You may need a multiple pill or a powder, really.
A lot of times when we come to a multivitamin, that's the first thing my patient says. Can I just take a super horse pill for all of this? It doesn't work that way.
You know, you use the expression vision, memory, and mobility. This is what we're trying to maintain. You really hit it on those three things. Expound a little more. Vision, memory, mobility. If I have that, I'm good to 80, 90, maybe even 100.
Absolutely, because it really does come down to knowing who you are, where you are, what year it is, whether you can get around or not, and whether you can see.
Yeah.
If you can do all those things at 100, you're not old.
Yeah,
Some
wonderful.
people don't do all of that at 40.
You know, we all understand that we're unique. We have unique talents and unique shortcomings. We're unique people. Does that also go into our nutritional needs? Is one vitamin good for everybody?
No, one vitamin's not good for everybody. For example, let's say you're stressed. When you're really stressed, the body uses an amino acid called taurine and B vitamins to excessive amount. So the body just chews up these nutrients. And so if you have a lot of stress, then you need to have a little more of those nutrients.
Now, something you do as a physician is you assess people's nutrient levels, and you alluded to that, but let's say I've tried several vitamins and I'm just not getting it. What would you do as a physician to help that person get their vitamins down right?
Well, as a metabolic anti-aging specialist, we do measure 35 vitamins in the body. We also measure pathways that use the nutrients, like amino acids, fatty acids, organic acids. We can even measure neurotransmitters, like serotonin.
Now, you know, my local family doctor doesn't do any of that stuff. This is unique and new. This is a new age of medicine, isn't it?
Well, medicine now, honestly, is at a crossroads.
It is.
The good thing is we have the science to look at the cause of the problem, not just treat symptoms, and we can personalize and individualize everybody's care.
You know, you mentioned that medications can have a profound impact on our nutrient levels. Expound on that. You talk about it in this book. You know, folks, what medicines are you taking? Do you know what nutrient it depletes? Almost every medicine now depletes something, doesn't it?
Absolutely. For example, if you are taking a statin drug to lower cholesterol, if you're taking a water pill called hydrochlorothiazide because you have high blood pressure, if you're taking a beta blocker, which ends in OL, all those kind of things are very commonly deplete the body of coenzyme Q10, a major fueling source. The same thing if you're taking a medicine by mouth for your blood sugar. The body gets depleted in Q10. We need Q10 for the brain to have fuel, the heart to have fuel, and us to have energy.
Yeah.
So we just have the patient take their medicine, but also replenish the nutrient that gets depleted.
You know, one of the ones that I always think about is birth control pills and the B vitamins for the young mothers who, they're planning their family. I get that. Birth control.
Absolutely. Anything that contains estrogen, whether it's birth control pills, patches, IUDs, natural or synthetic hormone replacement. If it contains estrogen, B vitamins get depleted. So we need to take extra B complex.
You know, a valuable resource we often overlook is our pharmacists in understanding our medicines. Do you find that we don't use them quite in the right way we should sometimes?
Oh, my pharmacist is my best friend.
Absolutely.
My compounding pharmacist, it's really a triad between the patient, the practitioner, and the compounding pharmacist.
We have such tremendous resources at our disposal, and the pharmacists we've worked with over the years, just outstanding people, full of knowledge. And it's not just about counting pills, is it?
No, it's not.
They know so much about our medicines, and we should use that. We're headed to a break, but when we return, I want to talk about, for a little while, orthomolecular medicine. What do you suppose that means? Think about that. We'll talk about it when we return.
May savings time is here again with our annual cancer-free celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online or call 888-442-1828 and place your order today. Ask about the auto ship program for additional savings.
I'm Dr. Richard Becker for Your Health at a Glance. More and more people suffer from asthma. One cause is obvious. The world is a polluted place, and the air we breathe is not always healthy. But other causes of asthma aren't as obvious. Recent research connects a poor quality, high sugar diet and the frequent use of antibiotics to higher rates of asthma and cases of asthma that are tougher to treat. A fast food diet does not meet our nutritional needs. Plus, the indiscriminate use of antibiotics can seriously disturb the delicate balance of healthy microbes in our intestinal tract. So switch to a garden fresh diet that calms and prevents asthma. Eat fruit-like veggies such as tomatoes, cucumbers, and eggplant. Eat yogurt, ginger, turmeric, and take fish oil. Nature holds the answer, but it's up to us to make healthy choices. For Your Health at a Glance, I'm Dr. Richard Becker. Hello, I'm Dr. Richard Becker.
And I'm Cindy Becker.
As a physician and cancer survivor, it is clear to me that standard medical therapies are not enough. We need more.
That's why we created our television program, to give you natural health solutions that really can improve your life.
And now we're offering another way to learn about your health by subscribing to our new monthly newsletter.
Every month you'll receive critical information about preventing disease, your diet, healthy recipes, holistic therapies, and alternatives to prescription pills. Each edition addresses personal issues that may keep you from getting well.
Each month I share with you the latest research found in scientific journals about diabetes, arthritis, heart disease, and other common problems.
With your new 12-month subscription, you'll get 3 additional months free. Become a subscriber today by calling 888-442-1828 or order online at bioinnovations.net for the best prices of the year. We're back, everyone, having a fascinating discussion with Dr. Pamela Smith about her book, What You Must Know About Vitamins, Minerals, Herbs, and More. What a great guide. This book is a must to put in your library. It teaches you how to use these vitamins. What are they good for?
What does it mean when I don't get enough? Well, to help you get the book, today with your purchase of a case of noni, whichever one you want, the regular, the concentrate, or the organic, you're going to get a copy of the book free. That's today only, so don't miss out on it. Well, Dr. Smith, there is a field of medicine, if you will, called orthomolecular medicine. We're starting to really study about that and bring that information to the viewers. Could you explain to us what that is?
Well, in orthomolecular medicine, basically, we look at how the body works. And so there's been a lot of people like Roger Williams and others who really went before us and looked at the cause of memory loss, looked at some of the causes of psychiatric illnesses, looked at why the gut didn't work, because if your gut's not healthy, you can't absorb the nutrients. And they really went before us and blazed a trail that allowed our generation to go forward when more science became available to really help people have personalized medicine.
Yeah, yeah.
Amazing.
You know, some of these early, I don't know, pioneers, let's say, in medicine, they recognize that high-dose vitamins can act as a drug. Isn't this part of orthomolecular? Can you explain that to us, the difference between nutrition and using them as a drug?
Well, really, honestly, it's all about balance.
Yeah.
So can you use nutrients as a drug? You can, like high-dose vitamin C. Linus Pauling took 20 grams of vitamin C a day.
Perfectly safe. No one's ever died from vitamin C.
No, perfectly safe.
Yes.
He won his last Nobel Prize after the age of 70.
Amazing, isn't it?
It is amazing. He lived into his 90s. So we do know that nutrients are very important. So for some things, we need to use a little higher dosage than what would be
people
considered.
may need high doses. That's what their need is, maybe.
Exactly,
Yeah,
because it is individualized.
Right, right. Well, let's talk about that a little bit. Now, you wrote this book to meet our nutritional needs, not so much for the orthomolecular approach. Am I correct in that, or do we talk about that a little bit?
It's all one thing, really.
It's all one thing.
Because the science is here now to support that nutrients are key for our body. In fact, pretty much our thyroid, the body regulator, it's kind of the conductor on how our body works, needs iodine. It needs B vitamins and other nutrients for the body regulator to work. In fact, all hormones need different nutrients to work.
Yeah. You also include quite a few dietary supplements, herbs and extracts, as, you know, a little background information so the reader can understand, for example, what boswellia is. Well, what is that stuff? You write about it. Tell us about it.
I do. Boswellia is an herb that decreases inflammation. A small amount of inflammation heals. If the body becomes too inflamed, then it leads to many kinds of different diseases. You can start from memory loss and go straight down the body to, for example, your mouth. If you have inflammation in your mouth and periodontal disease, it leads to heart disease and other diseases. You can go down the entire body, and boswellia is a great nutrient to decrease inflammation.
Another section of your book, you have multiple health conditions and a dietary and vitamin approach to the treatment of disease. You know, I was curious, reading through, and it's an extensive list, I don't know, 50, 60 conditions or so, quite a few. Doing research for that, after you saw all this evidence, because this book is well referenced. This is not just opinion. This is scientific evidence that we have. Seeing all that evidence, did things click for you? Did things change? Does it change your attitude to see all that?
It did.
Yeah.
I really tried to always be healthy, but it became really paramount for me to exercise 3 times a week for 20 minutes. It became even more important that I ate right, and then it became more important that I take nutrients and that my hormones worked right. It really takes all of those things for someone to be healthy and live to be a very healthy 100.
Yeah, you know, this isn't about your doctor saying, you better do this, that, and the other. It's about learning, isn't it?
It is.
Knowing the truth. I've always felt that's the most compelling evidence and the greatest motivation is to see the truth yourself.
Well, I always tell my patients that really I'm 10%. I'm here to educate you, but the patient themselves is 90% because they're the one that needs to eat better. to exercise properly, take the nutrients that they need. I try and tell them I'm really not their mother. I can't go home with them and say, hi, you need to take these nutrients today. But really important to take phosphatidylserine for your memory, because it increases acetylcholine, your main neurotransmitter of memory.
Right.
So in other words, it helps with names, faces, lost objects, phone numbers, things of that nature.
You know, in the minute and a half before the break here, one of our pet subjects is all the new information on vitamin D. 30 years ago, in training, did you have any idea that vitamin D could do all that we've learned today?
No, in fact,
I didn't know.
when I went to medical school, it was probably like when you went to medical school.
exactly.
We got 0 hours of nutrition.
Yeah.
Absolutely 0. But the good news is now doctors that are coming out learn more nutrition. But from a metabolic medicine viewpoint, we actually specialize in looking at how the body works, which much of it is nutritional.
So you are part of an organization that trains physicians in these methods, and there are ways to access these physicians, a referral list, or to come to see you. We're not in this all alone. We need our doctors. Isn't that correct?
Oh, absolutely.
We'll put your information up so people can gain access to this great source of medical information. You know, we've been through some tough times, and when our medical knowledge wasn't enough, you know, we went through cancer, I went through lymphoma. That's something you need help with.
Absolutely.
People need doctors.
And so if you go to the website, you will see where there's a fellowship-trained doctor, advanced fellowship, master degree practitioner in your area.
Thank you so much for that, because his children are suffering and they need our help. Thank you, doctor. We have a break. We'll be right back.
May savings time is here again with our annual cancer-free celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online or call 888-442-1828 and place your order today. Ask about the auto ship program for additional savings.
Here is our hope for you today. I'm Cindy Becker. In the epic movie Gone with the Wind, Scarlett O'Hara says she won't think about her problems today or she'll go crazy. She'll think about them tomorrow. How should we think about tomorrow in our lives? In Matthew 6, verse 33, we get advice about tomorrow. Seek first his kingdom and his righteousness, and all these things will be given to you as well. Therefore, do not worry about tomorrow, for tomorrow will worry about itself. It's so difficult to not worry about the future. Many of us catastrophize about the future. That's spending all your time thinking about all the catastrophes that might happen. So let tomorrow worry about itself. That way we won't miss the wonderful things happening in our lives right now. I'm Cindy Becker. This is our hope for you today.
Is your life out of balance? It may be. The average American consumes far too many omega-6s and not enough omega-3s. This creates an imbalance.
So what can we do to get back in balance? We can eat a healthy diet.
And most of us need to supplement with omega-3 rich fish oil. Fish oil contains omega-3s with DHA and EPA, fatty acids that promote good brain and heart health. So reduce omega-6 in your nutritional plan and boost omega-3 to get back in balance.
To help you do that, BioInnovations offers 2 products, the Fish Oil Complex and Omega 369, both formulated for your health and well-being. So how do you choose? For highest levels of DHA and EPA, choose the Fish Oil Complex. For a balanced formula, choose the 369. Give us a call at 888-442-1828 or go online at bioinnovations.net. Check out the AutoShip program for additional savings. We're back having a great discussion with Dr. Pamela Wartian-Smith. Isn't this hour just flying by? This is so much fun learning new things. Well, to help you get the special, here's the reminder for today. To help you get her book, What You Must Know About Vitamins, Minerals, Herbs, and More, what we have is a great special on noni. With your case of regular concentrate or organic noni, you're going to get a copy of the book free. Don't miss that one. It is today only. Well, Richard, I know you have a question that you're just waiting to get.
I have my list of dietary supplements and food extracts that I find remarkably effective in a variety of health conditions, things like CoQ10 and alpha-lipoic acid. Do you have your list of favorites, some of that you find are most helpful for a wide variety of your patients?
I do. In fact, all of my patients are on a multivitamin.
Good.
They all take omega-3 fatty acids, and they also take probiotics or good bacteria.
Yeah, well, outstanding. Boy, you know, this alpha-lipoic, we have diabetes, we have brain health concerns, cardiovascular disease. That group of three, 9 out of 10 Americans are affected.
Yes.
How can we, and some people have all three.
They do.
Yeah.
In fact, they commonly run together.
Let's imagine that scenario. That's our impetus. That's what we want to manage, control, prevent. Outline a program for us.
Well, if I was going to see someone with any or all of those diseases, the first thing you want to look at is how much they exercise. So it's important to exercise 3 times a week for 20 minutes. But what we don't want people to do is, if they're over 50 and they've been a couch potato, just to run right out there and exercise.
Yeah, sure.
They need to see their doctor for a stress test first.
It's a good idea.
Next, eating correctly. 4 to 5 small meals, sometimes 6 if you exercise in your meal a day, of a good glycemic index, meaning that people have to have good carbs, they have to have good fats, and the right amount of protein. So I would start with those as well. And then, of course, looking at hormones. The body has a number of hormones that it makes. They all have to be balanced to be healthy. And then lastly, I would look at nutrients. Or maybe I should say first.
Yeah.
Really, none of those have to go in a particular order, because in order for the patient to be healthy, they have to have all of these. Coenzyme Q10 is so important for a fueling source in the body. And the body gets depleted with age, it gets depleted with aggressive exercise, it gets depleted with nutrients. Just as important is alpha-lipoic acid. Alpha-lipoic acid protects the liver. It also is great for memory. It also helps prevent and treat neuropathy. The dosages are just different for different things.
You know, I think back of practice days of people with nerve pains, carpal tunnel, entrapment syndromes, ruptured disc, radiculopathy, sciatic, all this nerve pain. It's so common and it disables so many people. How could we help that with nutrients?
There's different nutrients that do help with nerve pain or neuropathy. Studies have shown that carnitine, alpha-lipoic acid, and B vitamins as a B complex have actual medical trials to help prevent and treat neuropathy.
This stuff works.
It does work.
That's the bottom line, folks. It works. And do you know anyone who's died from a vitamin? I don't know anyone.
No.
It just doesn't happen. These things are safe to do. Now, there's some general guidelines. Give us some good guidelines, safety guidelines for supplements.
Well, for one thing, if you have kidney failure or liver failure,
Good point.
then you shouldn't take any supplements without discussing them with your doctor.
Good idea.
Also, if you're going to eat a really big fiber breakfast or other fiber meal, then you don't want to take your vitamins at the exact same time. Because if you do, it stops the absorption of many of the minerals. So you want to wait about 2 hours after you have a big fiber load.
Yeah, yeah. You know, we saw a study that showed as we age, our immune system depletes a little. This is normal part of aging. And with age, we tend to not to absorb our vitamins and minerals as well. And this one study was looking for a drug that could counter that. But what they found was a healthy diet and dietary supplements, vitamins and minerals, work better than any drug they could find. Does that make sense to you?
It does.
See, I'm concerned about the decline with aging with our immune system.
And a lot of that happens because the gut is not healthy. So someone has reflux, IBS, GERD, constipation, diarrhea.
Or antacids and acid-suppressing drugs.
All of those things, the gut is not as healthy as it could be.
Yeah.
So we want to clear up the gut because the gut makes nutrients like biotin, vitamin K, etc., but it also is involved in how much gets absorbed. So a healthier gut equals a healthier patient. 70% of the immune system is actually in the gut.
Yeah. You know, people write us letters, and we try to help as many as we can, but I think the most common mistake we hear is they're looking for that one super agent, that one thing that will change their life around. And those things happen. It perpetuates that overall myth. But really, the true secret is the holism.
It is.
Yeah.
It's all about being healthy from the viewpoint of exercise, eating right, hormones, nutrients, and of course, spiritual health.
But what if I'm in a wheelchair? What if it hurts to walk? Do I still need to move?
Well, it depends on the different patient.
Yeah.
If you are able to walk, should you get up from the wheelchair and walk a little bit? Yes.
Yeah.
Every patient is very different,
Sure.
at least mobility.
Yeah.
So there's a lot of ways to be mobile even if you can't walk. You can exercise the different joints, you can rub the different joints, all of that's important.
You go into several herbs in your description of dietary supplements, and of course an herb is basically a plant. It's more complex. There are more rules involved with herbs, and you give us some good dietary guidelines for that. Can you name a couple herbs that you've had good success with that you admire?
I love the herb ashwagandha.
Oh.
Ashwagandha helps with stress. It's also very, very important for the brain, so it's a great brain nutrient as well. So I love the herb ashwagandha.
Yeah, I've heard you mention that several times. Good for stress, the adrenal glands, the adrenal burnout, correct?
Absolutely.
Yeah.
The same thing with the herb rhodiola.
Rhodiola, fantastic. Folks, the book is full of information and you heard it from the doctor first here. You've got to do your part, folks. You've got to do your exercise. You've got to get down on your knees and worship. I find this does so much for our stress.
I do
you
too.
agree?
I
Okay.
totally agree.
All right, folks, so let's go to our break. We'll be back for the wrap-up in just a moment.
May savings time is here again with our annual cancer-free celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online or call 888-442-1828 and place your order today. Ask about the auto ship program for additional savings. I'm Cindy Becker, and this is Your Health at a Glance. Are you following a low-fat diet? While it's true that too much fat makes us overweight, certain types of fat are actually good for us. Add to your diet omega-3 fats such as fish and flaxseed oil, and omega-9 oleic acid found in olive oil. And reduce in your diet omega-6 found in corn, safflower, and peanut oil, and saturated fats found in meats and whole milk dairy products. Studies show those fats can promote inflammation and chronic disease. The Mediterranean diet can help you make good choices, such as fruits, vegetables, whole grains, lean meats, fish, olives, and olive oil. So remember, increase omega-3 and omega-9 fats. Reduce omega-6 and saturated fat. For Your Health at a Glance, I'm Cindy Becker.
You've heard the news that the nutrients CoQ10, L-carnitine, D-ribose, and magnesium promote cardiovascular health. And now you're looking for quality supplements you can trust.
Dr. Becker's Bionutrients provides you the highest quality HeartSmart supplements. Dr. Becker's Bionutrients CoQ10 and L-carnitine feature BioSolve technology, which promotes maximum absorption of these critical cardiovascular nutrients.
That's right. Feel the Bionutrients HeartSmart difference when you start your journey to better heart health today with Dr. Becker's Bionutrients CoQ10, L-carnitine, D-ribose, and magnesium.
Just ask for Dr. Becker's HeartSmart plan at BioInnovations, and we'll help you get started today.
Order online or call 888-442-1828 and let BioInnovations assist you in making the right choices to better health. Ask about the AutoShip program for additional savings. Your Health is brought to you by BioInnovations, trusted products for your health and well-being.
We're back, everyone. Just a quick reminder to help you get Dr. Smith's book, What You Must Know About Vitamins, Minerals, Herbs, and More. We've got a great special on your case of noni, whichever one you want. Whichever one you get, then you're going to get a copy of the book free, so don't forget on that one. Okay, this is just such amazing information. Dr. Smith, this has just been such a great hour, and it's just going too fast. But I know that we talk a lot about magnesium. Richard and I both supplement with magnesium. Oh, yeah. Can you talk to us a little bit about how important that is in our body and if that's covered in the book?
I supplement with magnesium as well. It is in the book, and magnesium literally has 300 functions in the body. So it's very important to have a normal rhythm of the heart. Calcium in the body excites. We have to have balance. Magnesium relaxes. Okay. So it's actually great even for back pain because it decreases muscle spasms. It has a lot of different functions.
And our soils are deplete in magnesium. Isn't this true?
Absolutely. Deplete in magnesium, zinc, and other important minerals.
It just doesn't seem like I can get enough magnesium from diet. I mean, I have supplemented for quite some time now, and I do find it amazing.
Constantly, more and more magnesium.
It's hard to be toxic in magnesium. If you have normal kidney function, if you take too much magnesium, then you get diarrhea. So it's hard to overdose. Some patients need 200, 400, 600, 800 milligrams of magnesium. So again, a great muscle relaxant, overall health.
Great. You know, a combination of nutrients and extracts that I found is remarkable. Vitamin D, curcumin, and magnesium. Those three together. Start using them together for your patients. It's amazing what you'll see. Everything from hormonal problems, heart disease, depression, sleeplessness, chronic pain, they all begin to lift with that combination, supported with the other things, of course. What do you think of that combination?
That's a great combination, and we didn't mention, but magnesium is also very good to help regulate insulin, the hormone that regulates your blood sugar.
The diabetes link with magnesium.
Absolutely.
Wow. Well, Dr. Smith, you're so big. Where do you get the energy to do all this?
I try and practice what we're discussing today.
Yeah, makes a huge difference. Good sleep, good diet, good exercise, family support, professional, you know. What's new on the horizon for you?
New on the horizon is I will continue to direct the fellowship and co-direct the master's program in this field. I have a couple of books that are coming out next year, actually 3 of them.
Wow.
One I wrote myself called Stress and the Christian. The second one that I wrote all by myself on thyroid disease. And then the last one I co-wrote with pharmacists on nutritional depletions caused by medicines.
Will we have a chance to discuss those?
I hope so, absolutely.
Wonderful, wonderful. Well, thank you so much for being with us today. It's always so enlightening to have you with us. And your work needs to continue. You know, you mentioned you're training doctors. Is there hope for the future? Do we have new young physicians coming in that we can trust and put our health and life into their hands?
Absolutely. Medicine is at a crossroads now. It's changing. The science is here to help support looking at all this, including nutrition.
So there is hope.
There's absolute hope.
Absolutely.
Good.
Thank you so much. Come again. We want to talk those books.
That's right.
Thank you for the invitation.
Oh, thank you. Thank you, folks, for your kind attention. We'll be here tomorrow. Hope to see you here as well. Bye-bye, everyone.
Thanks, everyone. See you tomorrow right here on Your Health.
Hi, it's me, Anthony Sullivan. And yes, you've actually caught me at home relaxing, because life's been pretty worry-free since I got coverage with American Residential Warranty.
You won't believe what ARW covers. Heating and air conditioning, washers and dryers, kitchen appliances, plumbing, water heaters, electrical systems, flat screens and laptops, even pools and spas, and so much more.
Call American Residential Warranty. They'll get you covered.
1-800-935-4051.
Introducing Paisano, the authentic pizza oven by Granite Stone. Now make the world's most delicious pizza with real stone right in your own home. You simply set it and let it make golden, crispy, extra cheesy stone-baked pies in under 6 minutes. You can get your Paisano pizza oven for just 3 easy payments of $39.99. Plus, we'll ship your entire order free.
Call 1-800-299-6812 or order online at buypaisano.com.
Golfers, the future of golf is here. The coolest driver on the planet, Jack Ham, world's longest driver and #1 golf designer, has done it again. The Hammer Turbo Air, the aha moment. It's all speed. This is real golf technology. The Hammer Turbo Air, the world's longest driver. Go to hammerturbo.com now. Putting the science of speed into golf. Boom. Golfers, the future of golf is here. The coolest driver on the planet, Jack Ham, world's longest driver and #1 golf designer, has done it again. The Hammer Turbo Air, the aha moment. It's all speed. This is